Hi, my name's Trish. I teach the total joint classes here at Ohio Specialty Surgical Suites. I also teach these videos. Everything that I'm going to talk about in the class is in a booklet that we will provide for you. It's in a little more detail, has more information. Also, Maggie's business card is in your booklet. She is our total joint coordinator. I would like to draw your attention to this certificate of distinction. This is from Joint Commission, which is our governing body. We are the first outpatient facility in our whole country to get this certificate. So if you're wondering, why do I have to come to class? Why do I have to listen to this video? It's because Joint Commission comes every year, checks on us to make sure our standard of care is above average. We are specially trained, experienced professionals in a unique environment that significantly reduces the risk of infection. Our team provides comprehensive screening, and we've done thousands of successful surgeries. You do need a coach. Your coach can be a family member, a friend. Someone has to be with you around the clock for at least the first 72 hours or until you are stable and independently functional. You should be getting many phone calls from OrthoUnited Spectrum Campus, from the billing department, the surgeon's office, the therapy department. It may sound redundant, but we want to make sure everyone's on the same page so you can have a safe, successful experience. Here at Ohio Specialty Surgical Suites, we have a new app called My Mobility. When you go to your surgeon's office, they will start to initiate that, and you will be able to download it on your phone or your computer. Text messages or emails will start to arrive about 30 days before surgery. It's reminders. Did you get your lab work done? Did you get your EKG done? You will get texts and messages also after surgery, and it will remind you to do exercises. It will remind you to get up and walk. Also, you will be filling out a HOOS or a COOS survey. Now, that is mandatory by Joint Commission. It's about 7 questions. It asks what your pain level is. How hard is it to get up and down stairs, in and out of a chair? You will get these texts 3, 6, 9, and 12 months after surgery also, because Joint Commission wants to make sure that you have improved and your pain is less. Lifestyle changes, you must be ready and willing to engage in some self-management activities for an improved outcome. The doctors would like you to try and stop smoking, maintain a healthy diet, control diabetes. Weight management and activity and exercise are very important before and after surgery. In the back of your booklets that we will be giving you, there are some community resources where you can find out about all of these things. There's a couple major risk factors whenever you have surgery. The top 3 are blood clots, pneumonia, and infection. Here at OS3, we are very proactive in preventing those. Blood clots, the risk factors are advanced age, cancer, estrogen therapy, a history of blood clots, a history of stroke. Exercise is important before and after. Inflammatory bowel disease, a joint replacement. Doctors would like you to try and maintain a healthy weight. And if you smoke, they would like you to stop smoking. That includes e-cigarettes, vaping, and chewing. And if you have varicose veins, they would like you to wear compression stockings. If you've gone to our therapy department for prehab, they should have given you a little printout of some exercises to do. You can start these exercises before surgery as well as after. We're going to do some preoperative conditioning to help strengthen your knee and your thigh. You're going to be using a walker, so you need your upper body strength to push off of chairs and to use your walker. So you can do some bicep curls and tricep extensions. We will also have you do ankle pumps and ankle circles. You're just going to pump your ankles up and down like this and do little circles. That will circulate the blood back to your heart so you don't get blood clots. You're going to do some butt squeezes where you tighten your thigh. We'll also have you do quad sets where you strengthen your thigh muscle and you push your knee into whatever you are laying on. Those are especially essential for knee people. Most knee people are walking with a limp, so they shrunk the back ligaments and tendons. When they go to surgery, you're going to see that the doctor is going to straighten out your ligaments and tendons, and when you go to therapy, they will. So if you could start these before surgery, It's going to help you after surgery. We'll also have you do straight leg raises and heel slides. To prevent surgical site infection, all dental work must be completed 2 weeks prior to surgery or 6 to 12 weeks after surgery. If you have an appointment to have your teeth cleaned, make sure it is in those parameters. If you become ill near your surgery date, please let your doctor know. They may postpone it for another time. If you have a cough that you can't control, diarrhea, a temperature greater than 101.5, let him know immediately. No shaving or hair removal products near your surgical site for 5 days prior to surgery. If you need shaved, we have clippers here that do not cut the skin. And please report any broken areas on your skin, any burns, any rashes, anything that is open on your operative leg. They will cancel surgery. So make sure that if you're out in your yard doing yard work or anything, that you protect your skin. The best way to prevent infection, of course, is good hand washing, and we recommend 20 seconds, just like the CDC. You're just going to get in between your fingers, in between your thumb, do your nails, do your wrist, grab your water, and turn your towel and turn off the water. Preparing your home, make sure your handrails are secure. Make sure you remove any tripping hazards like cords, rugs, furniture. You're going to be using a walker. It has wheels on it. You need a little bit wider path between your bedroom and bathroom so you can get your walker in. You don't want any cords that the wheels of the walker can get caught up in. No chairs with wheels on them. We would like you to sit in a chair, straight back chair with arms. And then make sure that you move things that you use on a regular basis to counter height. If you are having a hip done, you're not allowed to bend over 90 degrees. If you're sitting in a chair, you're at 90 degrees. So you cannot go down to the floor, pick up anything off the floor. If you use a lot of cupboards that are down on the bottom, put it on counter height so that you're not bending over. Knee people, you are allowed to bend over, but you do have some numbing medicine in your knee, and if you bend over and try to pick something up, you could fall. Try to have a cordless phone or a cell phone with you at all times. If you're calling for someone else in the other part of the house, they may not hear you, but 9 times out of 10, they'll answer that cell phone. And then unless you have a personal chef, you might want to prepare or purchase meals ahead of time. You as a patient are not going to have the ability to prepare a meal, cook the meal, eat the meal, and do the dishes. You do need good nutrition to heal, so it's much easier to have things in the freezer that you could just pop in the microwave or the oven. Stairs are restricted for hips and knees. You are allowed to go up 1, 2, or 3 stairs to get in your house. You are not allowed to go up a set of 7, 10, 12, 14 stairs for at least 3 to 5 days after surgery. You're not going to have the strength. So make sure your bedroom and bathroom are on the first floor. If you do have to go upstairs, go up with your good leg, go down with your bad first. Make sure you always have a railing when you're going upstairs, and make sure you have a person with you behind you when you're going up the stairs and in front of you when you're coming down the stairs. All medications and supplements must be reviewed by your primary care doctor, any specialist you go to, the surgeon, and the anesthesiologist. If you are to take any medications the day of surgery, that's up to the anesthesiologist. And when the girls call you to tell you what time to be here for surgery, they will tell you which medications to take and which ones not to take. 2 weeks prior to surgery, all over-the-counter supplements must be stopped. No multivitamins, no vitamin E, no ginkgo, no fish oils, glucosamines. They all have blood-thinning properties in them, and they all interfere with anesthesia. 10 days prior to surgery, all aspirin and anti-inflammatories must be stopped. No ibuprofens, no Advils, no Aleve. They all have blood-thinning properties in them. The only thing you can take for pain is Tylenol. I know that doesn't work for everybody, but most of the doctors would like you to take 1,000 milligrams every 6 hours, and that does help with pain. If you are on a prescription blood thinner like Coumadin, Eliquis, Pradaxa, those are stopped 3 to 5 days prior to surgery, but that is up to the doctor that ordered them and your surgeon, and they will let you know when to stop those. Please do not stop taking your blood pressure medicine, cholesterol medicine, diabetes medicine, or thyroid medicine. Those are very important. You should be getting some prescriptions to be filled by your surgeon. They will call those prescriptions to your drugstore several days before surgery. Make sure you pick those up. Make sure you read them. Most of the doctors would like men of a certain age to be on Flomax. That would start 7 days prior to surgery. So if you do get that prescription for Flomax, make sure you start taking it. Also, you should have a front-wheeled walker. We do not want the walkers with 4 wheels, the brakes, and the seat. We just want a front-wheeled walker. That is going to be more sturdy for you. Most of the doctors would like you to order a Iceman Clear Cube. If you choose not to get an Iceman, make sure you have plenty of ice or gel packs because ice is going to be your best friend. We also sell ADL kits or hip kits. These are not mandatory, but these are a helpful hint for you, and most of the patients love them. We sell them here for $25. It comes with a long-handled sponge, so since you're not allowed to bend over 90 degrees, you can reach your feet and your back to wash. It also comes with a long-handled shoe horn, because you know how your tennis shoes are always turning in the back and you're bending over trying to get them unturned. This is a long-handled one, so you're not bending over. It also comes with a long-handled grabber, so if you do drop something, it will pick it up. And it comes with a sock aid. So for the next 28 days, you are going to be wearing these lovely TED hose on both legs. You as a patient are not going to be getting them on because they are thigh highs and you will not be able to bend over. What the sock aid does is you put your sock on it and you put it all the way down to the toes. And you can use these on your everyday socks also. If you have a bad back or bad shoulder, they really work nice. Then you throw this on the floor and then you put your foot in it and you're not bending over, you're just pulling on these nice long cords. And then it brings that sock up to a manageable position so that you can pull it up. Our whole kit is $25. Like I said, it's not mandatory, but it is a helpful hint for you. Also, if you do not have anything to hold on to in your bathroom, like a wall or a cupboard, you might want to invest in an elevated toilet seat with arms because it will be easier for you to get up and down. Most of the doctors would like you to invest in an ice machine. Unfortunately, none of the insurances cover it anymore. It does cost $150, but every patient that bought it loves it. They said it helped with pain more than anything else. It's just like a little cooler. You take the lid off, fill it up with ice and water, and then you attach the pad to that, and it circulates cold water. Stays consistently cold for a good 6 hours. You can use it on hips, knees, shoulders, backs, wherever you would need an ice pack. It does have Velcro straps that come with it, so you can strap it in place. So the day before surgery, you would get a call telling you what time to be here for surgery. The doctor sets the schedules. Sometimes we don't get the schedule till 4 or 5 in the afternoon, so don't panic if you don't get a call until 4 or 5 in the afternoon. When the nurses call, they will tell you exactly what to bring. They'll tell you exactly what medications to take. They will give you all the information you need before you come to surgery. If you have surgery on Monday, they will call you Friday evening. So the day before surgery, you need to be well hydrated. That does not include alcoholic beverages for that 24 hours. The reason we need you hydrated is because in the morning, we're going to start an IV. If you're dehydrated, your veins are dehydrated and it's very hard to get an IV in, and you want a nice solid IV. Nothing to eat or drink after midnight, but please don't stop eating at 4 o'clock in the afternoon. In the morning, we're going to give you some relaxing medicine, some pain medicine, and an antibiotic. If you have a totally empty stomach, you can get a little bit queasy. So before you go to bed, have a small snack before midnight. Not a big pasta dinner, not a big steak dinner, just a small snack. A bowl of cereal, a cheese crackers, a bowl of ice cream, a little turkey sandwich. Just have something in your stomach so you don't get queasy. So the night before surgery, you're going to take a shower with Hibiclens, which we have provided for you. You can wash your face and your hair like you normally do with your own soap. Wash from the neck down with the Hibiclens. Do not keep putting it on your washcloth or your sponge because it doesn't suds up. Concentrate on your hip or your knee a little bit more, but do not scrub it raw. And then rinse it off, wear clean clothes, and have clean bed linens. In the morning, you're going to take another shower with the HebaCleanse, and you're going to wash from your neck down. Same thing, concentrate on your hip or your knee a little bit more. Make sure you rinse it off and wear clean, comfortable clothes. If you have a knee done, you're going to have an ACE wrap on and some white fluffy dressing. You're going to have TED hose on, and you're going to have some SCDs on that I will describe later. Your legs are about this wide, so you want to make sure you have something loose and comfortable. Also wear loose, comfortable shoes because you do have swelling in your feet, and you also have your ACE wrap or your TED hose on. If you were told to take any medication, you may take that with 1 ounce or less of water. No jewelry, no piercings, no contacts, no valuables, no fragrances, creams, lotions, makeup, or nail polish. You are allowed to brush your teeth. Make sure you spit everything out, and you are allowed to wear deodorant. In the morning, you are going to be drinking a bottle of Ensure, and we will provide this for you. This is not the milky Ensure that you get at the drugstore. This is a strawberry Kool-Aid type, and the reason you are going to be drinking it is because it has additives in it to prevent post-op nausea and vomiting. Also, when we tell you you're not allowed to have anything to drink after midnight, what's the first thing you want to do in the morning is get up and drink something. So this is going to quench your thirst. It's going to stabilize out your insulin levels, and it's going to help with post-op nausea and vomiting. You are going to drink this 2 hours before surgery. When the girls call you to tell you what time to be here, they will tell you exactly what time to drink it. You want to drink it in about 10 to 15 minutes. You don't want to drink it over an hour. Also, you can take your morning pills with it, and you can put it in the refrigerator. If this is too sweet for you, do not deviate with anything else. No water, no coffee, no tea, no juices, no pops, no broth. It's this or nothing, and it's going to be 2 hours before your surgery. Bring 2 forms of ID with you, your insurance card and your driver's license. Bring all the prescribed post-op medications with you. I don't need the medications that you take on a daily basis. We just want the medications that you picked up at the drugstore from your surgeon. The reason we have you bring them is because we go over the side effects. We make sure that you have them all. If something's missing and you have your prescription at home, I don't know what's missing. I can't fix the problem. So bring them in. We'll get you set up on a 6-hour schedule. We'll go over all the side effects, and we'll make sure that you have all the proper medications. Also bring your walker with you. You do not have to bring your Polar Iceman with you if you know how to use it at home, if you're borrowing one. We do have ice packs that we use here. If you purchase an ice machine here or the hip kit here, it will be here the day of surgery. Just bring the $150 for that or the $25 for the hip kit. Arriving at Ohio Specialty Surgical Suites, you want to allow about 10 minutes extra to check in. You're going to park on the north side of the building, which is the Apple Grove side. You're going to come in the surgery doors, through the double doors, up to the elevator, and then up to our waiting room up here. You're going to check in. Once you get checked in, a nurse is going to come and get you and verify your height and weight. She'll do a little assessment. She'll listen to your chest. She'll do her vital signs. When you arrive at Ohio Specialty Surgical Suites for your surgery, your average length of stay will be 6 to 8 hours. This is our recovery room, and you will most likely be in one of these rooms against the back wall. Once you get checked in, a nurse will come and get you. She'll verify your height and weight. She'll do a little assessment, take your blood pressure, listen to your chest, and then she'll give you some nose swabs. So remember when I told you we have to do extra things to keep our certification current for Joint Commission? Joint Commission wants to make sure that our patients are educated. So the day of surgery, you're going to get 3 test questions. I'm going to give you the answers, and all you have to do is remember those, and the nurse will ask you those questions, and she'll want the answer. So the first test question is about nose and nose swabs. Everybody's heard of MRSA, MRSA. Those germs live in our nostrils, so we want to kill them. So the nurse is going to give you a nose swab, and you're going to swab your nose 3 times on each side. And she'll ask you what these nose swabs are for. You're going to say, so I don't get MRSA or MRSA. Then the nurse will start an IV. She'll give you some relaxing medicine, some pain medicine, and an antibiotic. Then the surgeon will come in and mark you. If you have any questions or concerns, that's the time to talk to him. And then anesthesia will come in and talk to you. Anesthesia is surgeon specific. You may have a general or you may have a spinal. The spinal, you are numb from your waist down for 4 to 5 hours. Also, all knee people will get a block. The block decreases the pain for 8 to 24 hours. Most people do not complain of knee pain. They complain of back of the knee pain because the block doesn't work back there and the doctor stretched those ligaments and tendons. And they will also complain of thigh pain because they put a tourniquet on. So you may have a really deep bruising pain there. Our family waiting room is kind of small, so we would prefer that you have 2 people or less come with you. Your family can wait in the hallway or in the waiting room. Your family can be with you until the spinal's done, the block's done, or you go to surgery. Once you go to surgery, we like your family to wait in the waiting room or in the hallway till the doctor speaks to them. If they go out to lunch or go downstairs to get fresh air, the doctor may miss them. He will go on to his next surgery and they may not be able to find out how surgery went. So please tell your family to wait in the waiting room or the hallway till the doctor speaks to them. Once the doctor speaks to them, it takes about 30 to 60 minutes before your family can come in and sit with you. Surgery time varies between 2 to 3 hours. It all depends if they're using the robot or the computer. Most of the doctors are on the 2.5 hour side. That does not include putting you to sleep or waking you up. Once you go to surgery, you're going to see a lot of staff members. You have the technicians, the anesthesiologists, the surgeon, nurses, CRNAs. Some people get a little bit claustrophobic because everybody pounces on you at once. They all have a job to do and they have to do them simultaneously. So someone's checking your IV, someone's hooking up your blood pressure, they're getting your head ready for anesthesia, they're scrubbing your leg and your hip. So be aware that there will be many people surrounding you before you go to sleep for surgery. It's also very cold in the OR, so be aware of that. It's actually freezing in there. We do have warm blankets that we can put on you. Once you do go to sleep, we put a bear hugger gown on you. It shoots warm air in there so you are nice and comfortable during surgery. But before and after that gown is in the way, please ask one of our staff members and they will get you some warm blankets. We're going to start with the arthritic hip. Your new prosthesis is going to be made out of ceramic, polyurethane, and porous materials. The reason we have porous materials is because we want your bone to grow in and make a nice tight fit. So if you are having a hip replacement, this is the new prosthesis that we'll be putting in. It's made of ceramic, polyurethane, and porous materials. Your doctor will be showing you this in the office and explaining how he does the surgery. For a total knee replacement, you are bone on bone. You are missing the meniscus. Your new prosthesis is made of titanium, cobalt, oxynium, and polyurethane. And this is the new implant that will be put in, and your doctor will be discussing that with you in the office. Incisions, if you are having a hip done, you're going to have an anterior incision right here in the front. If you're having a knee done, you're going to have an incision right down the front of your knee. Based on surgeon preference, you will be using one of these dressings on your wound. Your typical stay after surgery is 2 to 4 hours. In order for you to go home, you have to eat, drink, walk, and use the bathroom. A nurse will check you. The anesthesiologist will check you. We'll do 15-minute vitals. We'll check your circulation. We'll check your dressing. We'll have you do your ankle pumps and ankle circles as soon as you can. We will instruct you to take deep breaths and cough, and then we will give you an incentive spirometer. Whenever you have surgery and you have medications in your system, you breathe very shallow. When you breathe shallow, you don't expand your lungs. Fluids can build up in them and turn to pneumonia. You're going to take a deep breath, hold it for 2 or 3 seconds, and then exhale. So remember when I told you that blood clots are very prevalent after surgery? We want to protect you. So you are going to wear these white TED hose on both legs. They are thigh highs. The reason we have you wear them for 28 days is because 2 weeks after surgery, there's a very high incidence of blood clots, and 4 weeks after surgery, there's a very high incidence of blood clots. This is your third test question. The nurse is going to ask you what these are. You can call them my TED hose or my compression hose, and you're going to wear them for 28 days. On top of your compression hose, you're going to wear these SCDs. These are compression devices that you're going to wear on your calves to prevent blood clots. They're going to squeeze your calf and circulate the blood back to your heart so you don't get blood clots. The ones I'm giving you to go home on are battery operated. They both plug in at the same time. It has a split cord. They need charged about 3 hours in the morning. The best time to charge them is when you're at therapy because you don't need to wear them to therapy. And then charge them about 2 or 3 hours before you go to bed so they don't lose a charge at 3 in the morning. Once they're fully charged, you unplug them. There's a top and a bottom. There's no left or right, and they Velcro right on the calf. There's a little button on the top. When the light is blue, they're working perfectly fine. When the light is yellow, it means they're not feeling the compression, so turn them off and tighten up the Velcro. When the light is red, they're dead. When it's dead, you need to charge them. You will also be wearing these for 28 days to prevent blood clots. And that is your third test question. What to expect after surgery? In order for you to go home, you have to eat and drink something. We want to make sure that your stomach is okay. We have clear liquids. We have Coke products here. We have ginger ale and 7-Up. We do want you to eat something so that we know your stomach is okay. We have chicken noodle soup, peanut butter crackers, and pudding and jello. If you are gluten-free or you are on a special diet, you're more than welcome to bring something to eat. Also, your loved one is going to be here all day with you. They are permitted to bring a small snack or something to drink. They may drink that in your room. We do have 2 vending machines down at the end of the hall with all the soda pops and snacks if they want something. We'll manage your discomfort if you're having anything. In order for you to leave, you will have to eat, drink, walk with your walker, and go to the bathroom. We will go over all your discharge instructions, all your medications. We'll get them set up on a 6-hour schedule with you and your coach. If you've gone to prehab, they should have showed you how to use the walker. If not, I will go over it really quickly. You never want to hold your walker to sit down. When you hold your walker, it's just going to plop on top of you. Reach back for the chair arms, kick your bad leg out a little bit, and sit down. Same way standing up. Don't grab your walker because it's going to kick out from under you. It has wheels on it. So you want to use your arms of your chair and then grab your walker. When walking, I want you to walk as normal as possible. You are allowed to put full weight on your hip and your knee. So I don't want you limping. You're just going to take normal steps. Your walker has wheels on it. I want you to pretend it's a grocery cart and you're just going to walk normal. Heel toe, heel toe, heel toe, heel toe, and glide along. On the trip home, we can get you in most any vehicle. If you sit in the front seat, make sure that the seat is all the way back and the head of the seat is tilted. If you have bad shoulders or a bad back, you know where your handle is. It's way up here and it's very inconvenient. You can invest in a handy bar. The handy bar goes on the car door loop, and then instead of reaching up here, you have a nice sturdy handle here and you have your door over here. This is an expensive one from AAA. You do not need this expensive one. It has a glass cutter and the seatbelt cutter. Amazon sells them for $14.99 and it has a little light in it, and AutoZone also sells these for $14. Taking your medications at home. You must take your medications as the doctor orders. You're going to be on a lot of pain medicines. They all cause nausea and vomiting in some people, so make sure you eat with them. If you eat and you're still nauseated, we will give you an anti-nausea medicine to take home. All of the medications cause constipation, so make sure you increase your fluids, get some Metamucil, Fibercon, Miralax. We will give you a stool softener that you're going to take twice a day, but sometimes that's not enough. so make sure that you have something extra at home. Avoid alcohol, no driving while you're on your narcotics. You will resume all your home medications, except you will not be able to take any ibuprofens, Advils, NSAIDs, or any multivitamins or herbals. Swelling peaks between 3 and 7 days, but you can be swollen up to a couple months, especially after therapy. Bruising is normal. Hip people, you will bruise at the hip and sometimes all the way down to your toes. Knee people, you will bruise on your thigh where the tourniquet was during surgery. Ice is your best friend. You want to use the ice as much as possible. If you get the ice machine, you're going to use it continuously for at least the first week. You will be using your ice for at least a month because it's going to help with pain almost more than anything else. If you do buy the ice machine, do not put it directly on bare skin. You want to have a towel, a pillowcase, or long pants because it sweats and you don't want to get the incision wet. If you choose not to buy the ice machine, that's fine, but make sure you have plenty of ice packs and gel packs. When you're sitting in a chair, we like your legs to be elevated up on a footstool. If you have your feet down all the time, all the swelling is going to go to your ankles. Incision care, all of the doctors want you to keep the dressing that you were given to stay on until your follow-up appointment, and the doctor will take those off. So everyone can shower after your first therapy. The dressings that you have on are waterproof, but sometimes they get little wrinkles in there when you bend and straighten. So make sure you put saran wrap or press and seal around your knee while you're in the shower. No soaking in a tub, no hot tub, no swimming, no pets near your wound or in your bed. Diet and rest are very important after surgery. Some people say everything tastes bland, I'm not hungry. You may have a metallic taste in your mouth. That is normal, but you do need good nutrition to heal, especially proteins and vegetables. And then continue with plenty of fluids because of all the pain medicines. They can constipate you. You may sleep on your back or your side. If you are sleeping on your back, no pillows under your knee. Your legs are totally straight. If you are sleeping on your unoperative side, you can put pillows between your legs so your hips, knees, and feet are in alignment. You have to get up every hour during the day and walk around 5 or 10 minutes. Walking helps so you don't get stiff, helps so you don't get pneumonia, and helps so you don't get blood clots. The more you can bend and straighten your knee or your hip gently, adhesions don't build up and you will have less pain. So you need to get up every hour and walk around during the day. Therapy is very hard work. The better you do at therapy, the quicker you get out of therapy and off of your walker, and the quicker you can get to drive and do your activities of daily living. Make sure you take a narcotic pain pill about 30 to 60 minutes before therapy so you can do a good therapy. These are your test questions. The nose swabs are to prevent MRSA. The SCDs and the TED-HOs are to prevent blood clots. And the incentive spirometer is to prevent pneumonia. Do not stop using your walker until therapy tells you, and always sit in chairs with arms. No resistance training, no swimming until cleared by your surgeon. These are your hip and knee precautions. If you're sitting in a chair, you're at 90 degrees, so you cannot go down and bend over to pick anything up off the floor. If you are having a knee done, you do have numbing medicine in your knee, so don't stand and then try to pick something up off the floor. Your knee might buckle and you can fall. No crossing your leg at your knee or at your ankle, and no internal rotation with your feet or external rotation with your feet. The doctors like them straight up in a neutral position. Call your surgeon immediately if you fall, if you have any pain that's not controlled by your pain medicine. If you have a color change in your leg, your foot, your toes, they turn purple, blue, mottled, dusky. Stay cold even after you try to warm them up. Let him know. A red, warm, swollen calf is a sign of a DVT. Don't wait. Let your doctor know immediately. Any persistent numbness, tingling, or burning, even after you change positions, let your doctor know. Any inability to do any walking or exercise, let your doctor know. Signs of infection: temperature greater than 101.5, green, ooey gooey stuff coming out of your wound, excessive redness, excessive swelling. Let your doctor know. Traveling after joint replacement, you will alarm at the airport. The doctors may give you an ID card so that they will know you have a new implant. No long distance car rides or plane rides for 4 to 6 weeks after surgery, because we don't want you to get pneumonia or a blood clot. If you have to travel in a car for greater than an hour, make sure you have your TED hose on, your SCDs, and you do your ankle pumps. Avoid high impact activity. For the next 3 to 5 years, you will need a prophylactic antibiotic prior to any dental cleaning, any dental procedure, or any invasive procedure. Thank you for watching this video. If you have any questions or concerns, you can always call one of our staff members. We'll be happy to answer your questions. There is contact information in the booklet.